Okay. A very good afternoon to all of you. On behalf of Corazon team, I, Preeti Mistry, welcome all my HO colleagues as well as a field colleague of Alembic. 10th May is observed annually as a National Lipid Day since its inception way back in 2015. And it is my absolute privilege and pleasure to have all of you today with us in our effort to raise awareness about dyslipidemia. We all know that dyslipidemia is an abnormal amount of lipid in the blood, and it is a major risk factor for coronary artery disease, cerebrovascular disease, as well as a peripheral artery disease. It has also been observed that dyslipidemia is frequently induced by the person's diet and the lifestyle. But the good news is that the abnormal lipid level, that is dyslipidemia, do not immediately require the medical treatment. It does not require the use of lipid lowering agent because the preventive measures including health education, emphasis on the role of physical activity, diet, and timely visit to the doctor will help us in living the healthy life. So today in our endeavor to unite against dyslipidemia, on this National Lipid Day, we have the esteemed presence of renowned cardiologist from Mumbai, Dr. Bhupen Desai. Dr. Bhupen Desai is a consulting cardiologist with over 25 years of experience in the practice and currently practicing in Desai Heart Clinic, Borivali. He is attached with hospitals like Holy Family and Karuna Hospital, and he was also part of Wadia Hospital, Bombay Hospital, as well as Nanavati Hospital sometime back. And today, Dr. Desai will share with us his insight on how to manage cholesterol and keep dyslipidemia at bay. So without much ado, may I request Dr. Bhupen Desai to take over the proceeding of today's agenda. But before that, I would request all participants to put any question if they have related to managing the dyslipidemia. They can put the question in the chat box, which will be answered by Dr. Bhupen Desai towards the end of the presentation. So over to you, Dr. Bhupen Desai. Thank you so much. Sir, yours is muted. We are not able to hear you, sir. Sir, your microphone is...
Can you hear me now?
Yeah, now we can hear you, sir.
Can you see my screen?
We can see your screen.
Sure. So as Dr. Preeti rightly pointed out, today is a World Lipid Day, that is the 10th of May, and this is being celebrated all over the world. The whole idea of this Lipid Day is to generate the awareness about the lipid. What do we mean by lipid? Lipid in layman's term, in simple ways term, is the amount of body fat in the blood. That is what we call it lipid. There are several types of body fat, but the most important of them is cholesterol. So today we will discuss about how to manage cholesterol and keep dyslipidemia at bay. And what do we mean by dyslipidemia? Dyslipidemia is a combination of two words, dys and lipidemia. Dys means abnormal and lipidemia means fat. Whenever there is an abnormality of the fat, we label them as dyslipidemia. Whenever the cholesterol is increased, we call it as dyslipidemia. What is cholesterol? Cholesterol is a fat particle. It is a fat in the vessel. It's moving along with the blood. So cholesterol is a type of a fat found in the blood that is necessary for body to function properly. God has not given cholesterol only for the sake of any, joke. Cholesterol is also important for the body. We all need some amount of cholesterol for some of the most important body functions. It can form the steroid hormones. It can form the some of the hormones. It is important to make the outer wall, what we call it, the cell wall of the cells. So it is important, but much of that is harmful. So high cholesterol occurs when there is an excessive amount of cholesterol in the blood. So whenever body forgets to restrict cholesterol manufacturing, or if we eat too much of cholesterol containing food, then the cholesterol can go up. So high cholesterol is associated with a lot of problems. It can lead to buildup of plaque in the arteries. And what do we mean by plaque? Plaque is the deposition of cholesterol with some blood cells along with some muscle cells inside the blood vessels. So blood vessels, which as you can see here, is very smooth. It becomes rough. We call it a plaque. So this plaque is a one which is generated here like this, and then blood flow gets little disturbed, and the blood starts forming a clot over that plaque. So plaque is basically abnormal deposition of the cholesterol inside the blood vessel wall. And why are we so worried about this high cholesterol? Because it is the most important cause of heart attack, is a very important cause of stroke, or what we call it paralysis. Sometimes patient get transient stroke, they get little weakness for some time and they recover. Body always tends to recover something. So if it's a minor stroke, sometimes patient recovers. They come and tell us in our clinic, sir, I was walking and suddenly I realized my right hand has become lump. I was unable to speak. My jaw got deviated, my mouth got deviated. By the time he comes to our clinic, everything is normal. So these are called transient as the name suggests. These are called transient stroke. They are the precursor of major stroke. So if you ever get a transient stroke, you should never ignore it. And they can also, as Preeti rightly mentioned, sometimes they get deposited in the blood vessels of the leg vessels. It can sometimes lead to gangrene and amputation of the leg. So this high cholesterol is not a very mild thing. You should never ignore it. It can lead to problem, particularly if it remains unattended for a long time. There are two types of cholesterol. One is called HDL, one is called LDL. HDL means high density lipoprotein cholesterol, or in short, we call it HDL. Now, these are protective cholesterol. These are called good cholesterol because it helps in removal of LDL cholesterol. LDL cholesterol is a bad cholesterol from the bloodstream. HDL, if your HDL level is high, you are protected. If your HDL level is low, you have more chance of getting heart attack. What about LDL? The full form of LDL is low density lipoprotein cholesterol. And it is a bad cholesterol because high level of LDL cholesterol can lead to buildup of plaque in the arteries, as I told you. Once the artery plaque generates, it starts forming a clot inside and the blood vessel can totally block and can lead to heart attack or paralysis. Some facts and some myths about the cholesterol. Cholesterol is always bad. That is what we always feel. No, it is not that correct. High level of cholesterol is bad. Normal level of cholesterol or low level of cholesterol is good. Because our body needs cholesterol to function. As I told you, some of the hormones are manufactured by this cholesterol. The outer wall of the cells are formed by the cholesterol, so cholesterol is needed. But we do not require too much of cholesterol because God has given us capacity to form our own cholesterol locally. If the cell wants to make a protecting wall around it, it can manufacture its own cholesterol. So you do not require any flowing cholesterol in your blood. Higher the cholesterol, particularly the HDL, you are a little protected. But if your LDL cholesterol is high, then there is a risk of heart attack and paralysis. So LDL is a bad cholesterol, HDL is a good cholesterol. Thin people can't have high cholesterol. This is a very strong misnomer and myth, Patient comes to our clinic, sir, I am not overweight, I am not smoking, I am not drinking, I have no diabetes, I have no blood pressure. I just did routine my blood check and I say my cholesterol is high. The report is wrong. I can't believe. I am so lean and thin. It's a wrong thing. Whether you are fat or thin or overweight or underweight, anybody can get cholesterol. So it has nothing to do with your body weight. It has nothing to do with what sort of food you eat. If you're bound to have a high cholesterol, you're bound to have high cholesterol. Only older people would have cholesterol. This is another myth. Anybody can have cholesterol. Anyone can have a cholesterol. So there is nothing. I mean, age is not a bar. We as a cardiologist see a lot of young people also with a very high level of cholesterol. I have done an angiography of a 19-year-old boy who got a heart attack. And there are reports that people have had a heart attack at the age of 10 years, 12 years, 8 years, because these are called familial hypercholesterolemias, in which abnormal genes are there. These are hereditary disorders in which body tends to form too much of cholesterol from the birth. And by the time the child reaches the age of 8, 9, 10, 11, 12, he starts getting heart attack. So these are called familial hypercholesterolemia. These are genetic disorders. They are fortunately very rare, but age is not a criteria. Your body weight is also not a criteria. Whether you are male or female, that is also not a criteria. Cholesterol can affect anybody and everybody, as you can see in this slide. Now, this is a very British aristocratic lady. This is a doctor working in Africa. This is an African American lady working as a receptionist in USA. And this is a lady in Nepal. And this is a tribal in Masai Mara jungle of the Africa. Everybody can get cholesterol. They all look apparently normal. They are not very overweight. They are not underweight. Maybe roaming around normally, moving around, no history of chest pain, no history of heart attack. But if you do their blood test, you might find cholesterol to be high. So it's a great leveler, regardless of caste, creed, religion, socioeconomic status. High cholesterol can affect anybody and everybody. So how do we diagnose high cholesterol? It's a simple blood test. Now it is not necessary that you have to go fasting. Previously, we were asking the patient has to come fasting. But if you want to check your cholesterol only, you can go at any time of the day and get your blood tested. We will focus more on this LDL cholesterol rather than a total cholesterol or HDL cholesterol, because this LDL cholesterol is the most important cholesterol. So if your LDL cholesterol is more than 160, then you are in the red zone. That is very high risk. If your cholesterol is between 100 to 160, then you are in yellow zone. That means you are at high risk of developing problem at a later age. If your LDL cholesterol is less than 100, you are in the green zone. It means you are relatively safe. Similarly, HDL cholesterol, if it is less than 40, then you have more chances. I told you HDL is a protective cholesterol. So in males, if it is less than 40, and in female, if it is less than 50, they are at a higher chance of developing cardiac problems. Similarly, if your HDL cholesterol is more than 60, you are much better off. You are less likely to get into a problem. So we take a ratio of LDL by HDL. We divide LDL value by HDL value. And if it is less than 3.5, you don't have to worry. But if it is more than 3.5, means you are at a high risk of developing cardiac problem. So you diagnose it by doing a simple blood test. Now, what to do with it? If you are found to have high cholesterol in your blood, we have to control it. And how do we do it? Eat heart healthy diet. Means avoid fat, fried food, and all those things. Exercise regularly. Stop tobacco, not cut tobacco. You have to totally stop tobacco, any pan masalas, smoking, bidi, cigarettes, hookah, electronic cigarettes, everything you have to stop. You must get proper sleep. You must learn to manage stress, and you have to cut down your alcohol. Alcohol is permissible, but too much of alcohol is also harmful for cholesterol. So small amount of alcohol is acceptable, and absolutely no smoking, no tobacco in any form, whether it is tobacco paste or tobacco snuff. What are the steps to control high cholesterol? The first step is prevention. You must start adopting preventive lifestyle measures, which I'm going to discuss. You must eat proper food, the heart healthy food. You must do exercise, avoid smoking, don't take too much of alcohol, and meet your doctor regularly. Do your regular checkups of cholesterol because it can be totally asymptomatic. I'm sitting and I'm talking to you. If I do my blood cholesterol, it might be 300. I don't know. Nobody knows because high cholesterol may not have any symptoms till it ends up in heart attack or paralysis or something. Anybody can have cholesterol, so it is important that you see your doctor, do your regular checkups, check your cholesterol. Your doctor will perform and advise you to do it every 6 monthly or 1 yearly, depending on your risk factors. Suppose if you have a diabetes, if you're a smoker, if you're overweight, if you've undergone bypass, then doctor will advise you more frequently. If you are young, no other problems, it will advise you to do it every 1 year or 2 years. So then there are other treatments. So cholesterol usually have associated other problems. Many of these patients have associated diabetes, they have high blood pressure, they have obesity. Look at all those things and you have to treat all those things also. Isolated treatment of cholesterol is not going to work. You have to treat all the risk factors which you have. As you can see in this picture, the three musketeers. These are the friends of cholesterol. No? If you have high cholesterol, there are more chance of having high blood pressure. That is what we call hypertension. There's more chance of diabetes mellitus. Look at this sweet lady, sugary lady. Diabetes mellitus is also very common in patients with high cholesterol. All the diabetic patients, regardless of the cholesterol value, must receive some cholesterol lowering therapy. All diabetic patients, regardless of their cholesterol value, must receive some form of therapy to reduce their cholesterol, because most of these diabetic patients will eventually die of heart attack or paralysis, and that can be prevented by reducing cholesterol. And CAD means coronary artery disease, means heart attack. Blood vessel disease, blockages in the blood vessel. So whenever you have high cholesterol, his friends will be there with him, either blood pressure or diabetes or both, and eventually will lead to CAD, that is coronary artery disease or heart attacks. So how do you treat them? There are two parts to the treatment. First is lifestyle modification, which is very important and we always neglect it. Second is medication. Now we will not discuss about medication today because that is a part for medical meetings, for our meeting. So I will discuss more about lifestyle modification. If lifestyle modification does not work, then and then you require medication. But lifestyle medications are very helpful, very useful, and one should not neglect it. First, if you are overweight, lose weight. Very important that you lose weight. Obesity has direct correlation with cholesterol values. If you are obese, then there is more chance that you will have high cholesterol and likely to have more of other comorbid conditions like blood pressure, diabetes, blood clots in the leg, blood clots in the lung, and many other problems, sleep disturbances, sleep apneas, and all those things. If you are overweight, see your doctor, find out what should be the ideal weight based on your height, and you should lose weight if you're overweight. What does WHO, that is World Health Organization, recommends about the exercise? Adults aged 18 to 64 years should do at least 150 minutes of moderate intensity aerobic physical activity throughout the week. So if you are working, at least 30 minutes for 5 days in a week is the minimum level of exercise you should do. 150 minutes of regular moderate intensity exercise is absolutely mandatory. If you can do more than that, nothing like it, but at least this is the minimum you require to do to maintain your heart in a healthy state, to reduce blood pressure, to control diabetes, and to control cholesterol also. Now, why this information has come from? Where did we find this information about the exercise and walking we came to know? It came from a study which was published in journal called Lancet. Lancet is a very reputed journal in medical field. It comes from England. Way back in 1953, before most of us were born, in 1953, they conducted a big study of bus drivers and conductors in the London city. And what they found, coronary occlusion means heart attacks are much more common in drivers who he works for 8 hours, conductor also works for 8 hours. The 8 hour driver is sitting, conductor is standing and walking on the floor of the bus. Look at that. Coronary occlusion or heart attacks were much more higher as compared to this green bar, which is of conductors. So conductors had less heart attacks, drivers had a more heart attack. They were of the same age and they were of the same salary and same type of work they were doing in the same organization. And look at the death rate. Death within the 3 days of developing heart attack, it was both in drivers as compared to conductors. This is a very small, simple information which we got since 1953, before most of us were born even. This is data from more than 31,000 London transport workers. So very convincing data. So you must do some form of exercise. If you can't do a regular exercise, you must integrate this sort of exercise into your routine life. If you are going to office, do not use lift, start climbing the stairs. If you are going to office by bus, maybe you can get down one stop before and walk down to your office. So some sort of exercise you must integrate into your lifestyle. This is a very nice cartoon which says that I tried all fitness fads, but my doctor was right all along. Walking is still the best exercise. So there is no excuse. Whatever pair of shoes you have, you don't have to buy a sports shoes or something. You must start walking and start walking from today onwards. Complicated exercise machines or sweating it out in gym is not essential. Simple walking, 30 minutes a day, 5 days a week, sufficient. That is the bare minimum you should do it. What about diet? You must have diet which can help you to reduce your cholesterol. So dietary cholesterol has to be reduced. So eat foods which are naturally high in fibers like fruits and vegetables and unpolished grains. Eat fruits and vegetables in plenty. Morning, evening, every day you eat it. Limit food which are high in saturated fat like red meats, like ghee, butter, and all those things. Limit intake of added sugar. Now, this is also known that all these colas which we drink, they have a lot of sugar. Though we may not get a sweet taste out of it, you might feel the fizz of it, but they all contain a lot of sugar, and excess sugars are converted into fat. So avoid added sugar related beverages. You have to do cardio and strength training. If you can walk, nothing like it. If you get some time, better join a gym, or maybe you can do cardio strength training at home also. Regular aerobic exercise, I told you, all you need is a pair of shoes. That's brisk walking, cycling, but do some form of exercise. Stop smoking. Smoking, absolutely. Once you quit smoking, 80% lower relative risk of heart attacks, and you might do some yoga and meditation and mental relaxation exercises. So how do you manage cholesterol in corporate sedentary life? So this is a common question being asked to me regularly. Patient comes to my clinic, sir, I'm very busy. I leave home by 8 o'clock. I come back home at 10 p.m. No time for walking. What do I do it? So I tell him these simple exercise things. Eat healthy diet, because you leave home very early and come back late in the night. You're eating outside. Eat dabba from home. Eat healthy food. More of vegetables and salads in your diet. Do not eat fast foods or vada pavs and pizzas and bhajiyas and all those things. Avoid all those fried foods. Manage stress. Do some sort of mental relaxation exercises, meditation. Maybe you can do yoga. And now most of the big corporate offices have provided a place for doing yoga and exercises. I know of many IT companies where a lot of young people are working. They provide you with the gym facilities. They provide you with the yoga rooms to make use of those rooms. And if your office does not provide, maybe you can do yoga in your own table. Sit there, take deep breath, do a little bit of exercise, and at least in a year, go and get your medical checkup done. You may be looking absolutely healthy and fit, but it is very important to get a regular medical checkup by a properly qualified doctor. Please don't end up with a quack. So this is a very interesting cartoon. Again, I like this cartoon very much. Now, this is the HR manager talking to the company's doctor, and what he says: we built the company parking garage 6 blocks away. That is our health plan. So all the employees were forced to walk to the office because their parking lot was far away from their office. So they had to park their car and walk down up to their office, and that involved at least exercise which was needed for their good health. Yoga will not only give you a very toned body, very exciting body, but it will reduce your cholesterol, it will reduce your blood pressure, it will reduce the chance of getting heart attacks and all those things. So yogas are very, very important. Now, worldwide yogas have been accepted. Now, Prime Minister Modi is also promoting yoga. India is a big way promoting yoga all over the world. Stop smoking, and not only cigarette. It is the bidi, it is the tambaku, it is the chewing tobacco, it is the pinny, the snuff, the tobacco paste. In all forms, tobacco should be avoided because smoking increases your blood pressure, which will lead to, if you have high cholesterol, it will be a double-added risk factor. It can lead to heart attack. It also decreases HDL cholesterol, which is a good cholesterol, as I told you. Damages the arteries and blood cells. It leads to more of plaque formation inside the blood vessels, even with the normal cholesterol level. So smokers are at a great disadvantage. So stop smoking absolutely. It increases the incidence of heart attack, and it contains more than 4,000 chemicals, of which 200 are poisonous and very, very harmful. It is not only related to the mouth cancer or lung cancer, but stomach cancer, bladder cancer. Many cancers have been associated with smoking. At the same time, it is very important to prevent heart attack if you stop smoking. Yes, by all means, you can take alcohol. Alcohol is not bad for the heart, but please take it in moderation. Please take in the within limits. Don't go overboard. Don't go into binge drinking like this. It is harmful to your heart. And too much of alcohol also leads to increased cholesterol. Small amount or moderate amount of alcohol is permissible, but too much of alcohol is not good. Small changes in your daily routine can lead to a big improvement in your lipid level. So if you want to control your cholesterol, or if you want to prevent your cholesterol to go up, maybe you can make small changes in your daily routine. As I told you, instead of using lift, you can start using the lift. Instead of using lift and the elevators, maybe you can start climbing the stairs in your office. Maybe in the railway station now they have provided with escalators. Instead of using escalators, maybe you can start using stairs in the railway platforms. Park your car a little far off and then walk down. If you do not get time, you can walk in the passage of your office. You can, if you do not get time, maybe in your residence, around your residence, you can walk. But do integrate some form of exercise into your daily routine so that you can take care of your heart, enjoy a better tomorrow, control your diet, stop smoking. The hard truth is it is up to you to protect your heart. So start from today. Thank you so much. And if you have any questions, I'll be very, very happy to answer your questions. Thank you so much.
Thank you so much, sir. So there are some questions which has come from the team. So I'll orate it on behalf of them to you.
Yes, Nitesh.
Yes, sir. So there is a question from Manoj from Ahmedabad. So which are the things you suggest to do in medical checkup once in a year?
You must check your blood pressure, blood sugar, and cholesterol. You must check for your lipids. At least in a year, once in a year, you must check your lipids, because we Indians are at a great disadvantage. We get heart attacks, get severe heart attacks. We get heart attack at least 10 to 15 years earlier as compared to our Western population. We are at a great risk, and we get heart attack even at a relatively low level of cholesterol. So at least once in a year, you must check your blood pressure, you must check your sugar, and you must check your cholesterol.
So there's a question from Mr. Dheeraj. He's from Mumbai only. Doctor, will dieting help to control dyslipidemia?
Yes, dieting is a part and parcel of dyslipidemia. So diet, you must have a heart healthy diet. So avoid those, as I told you, bhajia, pakoras, vada pavs, and pizzas, and fried food, and the processed foods, and all those things. Eat more of fruits, vegetables. Eat more of a healthy food. So it helps. So this is the first step. After giving good go at lifestyle modification, including diet and exercise, if your cholesterol has not come down, then the second step is medication.
Sure, sir. So there's a question from Mr. Sunil from Ghaziabad. Sir, thank you so much for the presentation. How can I increase the HDL?
There are very few things to increase HDL. Pfizer had spent billions of dollars to develop one drug. It showed that the HDL level increases. The death rate somehow some peculiar reason did not improve or increase a little bit. So they could not market the drug and they burnt out billions of dollars. So there is hardly any drug to increase HDL level. Best part to increase HDL level is regular walking. Regular exercise definitely increases your HDL values. There are no drug for it as of now.
There is a question from Ritesh from Delhi. Doctor, does desi ghee or processed oil that balances PUFA and MUFA can help control dyslipidemia?
Whatever oil you want to use, including ghee, the quantity should not exceed half kg per person per month. If you are husband and wife, 30 days of your 1 month, you should not exceed whatever cooking medium you want to use by more than 1 kg. So half kg per person per month. Whatever cooking medium you like, whether it is a ghee, butter, or mustard oil, or whichever oil you like, sunflower oil or groundnut oil, whatever oil you like. Depends. See, India is a very varied country. In South, the people use a lot of coconut oil. In East, they use more of mustard oil. In North, they use more of ghee. In West, they use more of groundnut oil. So whichever cooking medium you like it, based on your taste, you can use it. But as I told you, you do not want cholesterol is not a poison, but if it is too much, it is poison. So we require some amount of cholesterol. So whatever cooking medium you like, you use cooking fat, but it should not exceed half kg per person a month.
Sure, sir. There's a question from Abhishek from Patna. Doctor, I did my lipid test today and I got triglyceride level of 354. Please suggest, should I go for lifestyle modification or will I also be needing medications?
Yes, we have not discussed much about triglyceride. Triglyceride is another fat like cholesterol, but it is a less risky proposition as compared to cholesterol. Cholesterol has been much more riskier as compared to triglyceride. So triglyceride 354 is high, but there is nothing to panic about it. And first, you should rule out the secondary cause of triglyceride. The most common cause of increased triglyceride is uncontrolled blood sugar, diabetes. So look for diabetes. Control it, your triglyceride will come down. Cut down on your weight. Obesity is also associated with high triglyceride levels, so you cut down. There are certain thyroid disorders. If you have hypothyroidism, then triglyceride can increase. So rule out the secondary cause. Control your diet, first of all. Triglyceride is associated with uncontrolled calorie intake, uncontrolled diabetes. If you are taking high calorie diet, you must cut down high calorie diet. If you have sugar, you must control sugar. If you have triglyceride, if you are smoking, you stop smoking. Triglyceride is also associated with too much of alcohol. So if you are taking alcohol, stop it, start walking. And after the 4 to 6 weeks of doing this lifestyle modification, if your triglyceride doesn't come down, maybe you'll require some treatment. Get in touch with your doctor, he'll prescribe you some treatment. There are two types of treatment for that. One is we give statins, which are mainly targeted at cholesterol, but they also tend to reduce triglyceride. And then there are certain drugs like fenofibrates. They can also reduce triglyceride, but you cannot take it on my prescription. You need to see your doctor after giving a good try to lifestyle modification. And then if it is still high, then we will prescribe you some medication.
Sure, sir. Thank you so much, sir. So there's a question from Mr. Prasenjit from Siliguri. Sir, high HDL is good or bad for the heart?
High HDL is good for heart. HDL is a protective cholesterol. So if you have a high HDL, the chance of getting heart attack is much less.
So there is a concern question, I think, raised by Mr. Ramakant from Mumbai. Doctor, nowadays I see many people in their 25s and 30s. They have the heart problem. They look very fit. They do the daily exercise. They have no obesity, no history of BP or diabetes. Yet they'll end up with cardiac arrest. What is the exact problem, and how do we can ensure to prevent such things?
I told you, I showed you one of the slide, and I told you increased lipid level is a great level. Whether you are rich or poor, whether you are American or African, whether you are graduate or illiterate, man, it affects everybody. Everybody. So always, as I told you, every year you must check your cholesterol, check your BP, and check your diabetes. There are three major risk factors which can be cause for the premature heart attacks, and patient can die. And as I told you, in India, we get heart attack at a much younger age. So we have to be very cautious. Even if you're absolutely fit, you have no disease, please make it a point to check your cholesterol once in a year at least. Once in a year, you check it. If it is high, you start controlling it by lifestyle modification. And if you still can't do it, then start some medication for that. But yes, I have seen, as I told you, I've done angioplasty of a 19-year-old boy, and I did an angiography of a 16-year-old schoolboy who came to me with chest pain, and ECG showed a heart attack. So it sometimes can come at a very early age. Never ignore. Apparently, you may be absolutely fit, but please go and see your doctor. Take your blood pressure, even if you feel absolutely fit. Take your blood sugar and check your cholesterol value.
There's a question from Sumit Kumar from Samastipur, Bihar, and I think he's very much inspired with the second last slide that you have shown of quitting the smoking. So he has asked, sir, what should we do to leave the smoking?
So it requires a mental strength. See, I have been practicing cardiology for more than 30 years. So when a patient comes to me, he gives me history of 40 years of smoking 20 cigarettes every day. When I tell him now you're in ICU and you've got a heart attack, he stops at that moment. Nothing happens to him. Same is when you see a lump in his throat and we tell him that you've been diagnosed with cancer, stop smoking from that moment only. So all it requires is a strong willpower. You will feel little uncomfortable for 1 or 2 days. You might get some withdrawal symptoms. Maybe you can keep some supari or some cloves or some elaichi in your mouth. Buy some chewing gum. Keep chewing gum. It is more of a mouth-related craving rather than the brain-related craving. So keep some supari, some elaichi, some chewing gum. Keep chewing it and stay away from the cigarette. And you can never leave cigarette by planning it. Tomorrow, my son's birthday, I stop it from tomorrow. No, it has to be from now, from this moment only. Immediately, you have to stop smoking means stop smoking. Make sure cigarettes and matches is not available at home. So even if you get a desire, you will not have it. So make sure that they are not easily accessible to you. Throw it off. You will be able to stop it. 1 or 2 days you will feel uncomfortable. You will be able to stop. It requires a strong willpower. That's all. Because each and every patient stops, but they stop quite late. Once they get heart attack, once they get cancer, then they stop it. But we have to stop. We are sensible fellows. We have to stop before we'll end up in heart attack or cancer.
Right, sir. I think that very well said. And Mr. Sumit, who has been inspired by the presentation, he will definitely try the ways out to leave the smoking. So there's a question from Arjun from Patna. Doctor, can you please tell that whether sleep pattern impacts dyslipidemia?
Yes, sleep pattern has a very mild correlation with increased cholesterol, but it is strongly correlated with heart attacks, diabetes, blood pressure. So there is something called obstructive sleep apnea. There are many people who do not sleep well at the night, particularly little overweight. They snore a lot. We call it sleep apnea, obstructive sleep apnea. It is grossly underdiagnosed all over the world, not in India, but all over the world, even in Western population. So if you have disturbed sleep, if you are snoring, you should do a sleep study. Now, most of the hospitals are doing sleep study. It's a very simple study. They check your oxygen level when you're sleeping in the night. And oxygen level goes down. So these are called sleep apnea. This is easily treatable condition. All you have to do is to use a mask which gives room air at a slightly higher pressure so that your tongue does not fall down or your air pipe doesn't collapse. Oxygen keeps on going. But unless this is diagnosed, unless this is corrected, there's a very high incidence of sudden cardiac death, heart attacks, irregular heartbeats, high blood pressure, and diabetes with this. There are many patients where we give 3-4 drugs to control blood pressure. It still doesn't come under control. We universally always advise them, even if he's not fat, to look for the sleep study. And many times we have found, even in normal weight patients, we have found significant obstructive sleep apnea. It can be easily diagnosable. Only thing is, there's no awareness. Most of the doctors also don't know about. So that is why they don't prescribe. So if you have a high BP, if you're a little obese, if you're snoring, you must look for sleep abnormality called sleep apnea, obstructive sleep apnea, or in short, it is OSA. If it is ignored, that can lead to sudden death.
So I have one question, Nitesh, in continuation to the sleep apnea. So, sir, when you are saying that obstructive sleep apnea could be one of the, can lead to the heart attack, how to control that? How do one diagnosis is possible through the tools?
Control is also very easy. Once you are diagnosed, there is a machine, there is a mask available. Okay. You put that mask when you sleep in the night. You put that mask. Mask is connected to a small rectangular box which is electric operated. It gives this room air at a slightly higher pressure. Basically, if you are using a very cheap quality straw and you suck it, what happens? The straw stucks.
Yeah.
So sometimes some people have a very lax airways. When it takes a deep breath, it gets like a straw, it gets stuck. Oxygen does not go in, air does not go in. So this machine gives the room air, only room air at a high pressure, so that this windpipe doesn't always open, it doesn't get struck.
Okay.
But it's very simple. You have to invest some 25,000-30,000 rupees to buy that machine. The machine's last lifelong. You have to use a mask, you have to connect the mask and sleep with it. You will get such a lovely sleep, you'll never realize it. People who have suffered OSA or obstructive sleep for so many years, and when we prescribe them this mask, the first thing he comes and tells the doctor, I had a very peaceful sleep. Very, very peaceful sleep.
That's a wonderful, solution what you have suggested. But I think there is a lack of awareness about this treatment. Not many people are aware of this.
Yes. It is grossly underdiagnosed entity because people don't think about it. That is the reason I mean. Even in the Western world, so if you feel daytime somnolence, drowsiness at daytime, if you are snoring, if your wife is complaining that you snore too much, if you're a little overweight, if you have high BP which is not getting controlled with medication, if you have high blood sugar which are not getting controlled with, then you must always look for this sleep abnormality.
Sleep abnormality.
There is a new science now. Sleep studies and sleep medicine is a new science now. A lot of things have been done now. So all the big hospitals, if you are in Bombay, all the big hospitals do it. The hospital where I am working, Holy Family Hospital, Karuna Hospital, and now there are a lot of freelancers also. If you want to do that, you just let me know. I will send your person to your home. He'll charge you 3,000 rupees. We'll put one small tube in the nose and one belt on the chest. The battery inside that belt. So that sees the movement of the chest, and there is a small thing they put it in your hand to look at your oxygen level. And you sleep in your own night dress, on your own bed, with your own pillow, and with your own blanket. So you get your natural sleep. During sleep, the machine records everything. It costs 3,000 rupees, and next day he will come back and take that machine back and there is a chip into it that they put into computer and analyze the sleep data.
So I think this is a wonderful clue for us in terms of creating awareness from the patient education point of view, because we also have a Roseva brand of rosuvastatin. And if we want to do something related to patient awareness, probably this is one thing which we can reach out in the form of a lot of information related to sleep apnea and its impact on cardiovascular mortality. I think that will be the great insight what you have given to us, sir. Sir, one more question I have. As you know that in today's time, the intermittent fasting has become a fade, or it is well proven science. It is its impact, in fact its result have been backed by many ancient studies also. So does intermittent fasting help to reduce the cholesterol?
To some extent, yes. I don't know when a big study of great data internationally, or see, whenever you need to have to speak something, then you need to have a conviction. Conviction will come from some data, some studies, some research. So these are all observational studies. They feel that once you do intermittent fasting, your cholesterol goes down. There is no proof of it, but people who do it, they find it beneficial. But as of now, there is no scientific data to support it. I can't recommend it, but if you feel better, you can continue with it. It doesn't harm, at least.
Okay, it doesn't harm, at least. Okay. Just one more question, Hitesh, before you take over. I have read somewhere, in fact, earlier when the Saffola was promoting, healthy heart oil, they were also recommending the mixing of certain oil in a proportion which becomes a right cooking medium. So that is one option. Second is that I have also heard in many scientific platforms, doctors recommending the change of the cooking oil after every 3 to 4 months. How far it is acceptable, or how far it is recommended by you, sir?
See, we are Indians. I think the food is very important part of our culture. So Saffola was totally a marketing gimmick. I don't think so. As I told you, you can use any cooking medium. The quantity should not exceed half kg per person per month. You use any oil, whichever oil you like. Now in Europeans, they promote a lot of olive oil, double virgin olive oil, which is a little expensive. Cost is not a consideration, but the taste you will not like. It is not suitable to Indian palate. So there are some data to suggest that olive oil is good for the reducing cholesterol, good for the heart. But the taste, people will leave it after 1 month or 2 months. And if you insist too much, then he will change his doctor also. So whatever cooking medium you like, whether it is ghee, butter, whether it is mustard oil, groundnut oil, safflower oil, cotton seed oil, whatever you want to use, but you should not exceed more than half kg per person per month. Some amount of fat is needed for the body's function. So our target is not to bring cholesterol to zero. So some amount of fat is needed for it.
Yes.
Some amount of fat will be provided if you use half kg of this oil You don't have to. I mean, you don't have to change your lifestyle very drastically. You don't have to eat totally fatless or without fat, without fried food. You can whatever oil you are using for making tadkas and all those things. What they call it bagar in Gujarati or in tadka in Punjabi. Oil is permitted.
Permitted. Fine, sir. Thank you. Yeah, Nitish.
Thank you, ma'am. Sir, there is some question which is coming very frequent, and it's related to the profession. In fact, doctor, as you know that most of the time we don't give priority to the heavy breakfast, and we prefer to take heavy food at night. And to add on that, there is one more question similar to that. The doctor, in the field when we are, so what kind of food do you recommend as a part of the healthy diet? What is your suggestion?
If you're in field, you carry a box of some salads or fruits with you. It is important to eat fruits, not the juice. Juice are easily available, but juice will provide you a lot of calories only without fiber. Those fibers are also very important. Fibers also help in reducing cholesterol. So eat healthy food. Do not eat bhajiyas and vada pavs and pakoras and what do I say, fast food and pizzas and burgers and all those things. Unfortunately, we are following Western tradition very much. Pizzas and burgers have become very popular in Indian setting, and I see a lot of young people munching on pizzas and all those things. And now those food delivery apps, even in the middle of night, the food are delivered to them. Those are containing very high amount of fat and high amount of salt. These are not good. I mean, they are blindly following this Western culture. So eat more of fruits, eat more of vegetables, and take a healthy, proper diet. I mean, roti, dal, sabji, everything you can take it. There's no harm in it. But avoid those street foods and the fast food.
Sure, sir. So there is a question from Mr. Anil Mali from Ahmedabad. The doctor, all diabetes patients, shall they must consume statins? Please share your views, sir.
Yes, each and every diabetic patient eventually die not because of high sugar or low sugar. He eventually dies because of heart attack. Exit of large number of diabetic patients from this world is because of the heart attacks or heart related problems, heart failures. So to prevent that, you must give statin. So now the recommendation is, even if your LDL cholesterol is normal, you should be given statins. All diabetic patient must receive statin regardless of their cholesterol values to protect them from getting heart attack.
We'll take one more question because there are many questions and we're taking.
I'm okay. No problem.
Yes. There's a question from Mr. Mahendra Salimbag. Doctor, what does lipid peroxidation causes and how can we protect from this?
Lipid gets oxidized, That is what we call lipid peroxidation. So this LDL particle, which I told you, cholesterol, which is low density lipoprotein, these are oxidized in the body. So oxidized LDL particles are much more harmful. They are the one which sticks to the blood vessel and forms a plaque. So this is what lipid peroxidation is. So it's more of a biochemistry thing. But LDL per se will not be very harmful, but in the body it gets oxidized and starts sticking. And this process is much more common in smokers. So you avoid smoking.
Sure, sir. We'll take some couple more questions. Mr. Nand Kishore from Noida. Sir, sleeping more than 10 hours, what are the chances of heart problems?
Sleep deprivation is definitely associated with heart attacks. Sleep deprivation, as I was telling you about obstructive sleep apnea, 10 hours is not recommended, but 6 to 8 hours of good sleep per day is very important to reduce heart attacks, to reduce blood pressure, to reduce chance of diabetes, to generate a good productivity from you. If you don't sleep well, if your sleep is fragmented or disturbed, you will not be able to do a good work at the daytime. There will be a lot of irritability, headache, lack of concentration, indigestion, a lot of problems will be there. So it's very important that you have at least 6 to 8 hours of peaceful sleep in 24 hours.
So there's a question from Mr. Neeraj from Mumbai. Sir, any medical device or digital health intervention to give us real-time monitoring which can help us to prevent dyslipidemia?
No, I think there are no devices or anything. You have to do walking on your own. I mean, your mobile phone cannot work for you. So you have to walk for 30 minutes every day. You have to eat a normal diet. There are a lot of apps and devices which keep sending you reminders. Have you taken your medicine today or not? Have you walked or not? How many steps you walked today? How many minutes you walk? So those are little inspiration. If you have not walked, it keeps on reminding. So those apps that way are helpful indirectly, but You have to do it yourself. The apps are mainly to, what do I say, to inspire you, to tell you that you have finished 8,000 steps, you are lacking 2,000 steps, do it now, do it now. This will send you an alarm that today you have not walked enough. So it reminds you to keep walking. It reminds you to take your medicines if you are taking the medicines.
Sure, sir. Thank you so much. So we come to the closure of the session now, because the questions will keep on coming. And at one point of time, it is a time to, come to the closure, sir. So thank you so much, sir, for such a wonderful session. On behalf of the entire Olympic team, we thank you, Dr. Bhupen Desai, for addressing all the queries that has come in a much practical way. And I'm very much sure that, sir, whatever the guidelines, what the suggestions you have suggested, we'll be incorporating that in our day-to-day lifestyle, and will ensure that we all unite against dyslipidemia, so that we all have healthy heart. Thank you so much to the technical team for arranging flawless webinar. And thank you once again, the entire Olympic team in the HO, in the field, for uniting and being present in this live session from sir. And thank you so much once again, sir, for such a lively session. Thanks a lot.
Thank you so much.
Thank you so much, sir.
Thank you, Nitesh. Thank you, Manda. And I hope I have tried my level best to generate some awareness about cholesterol on this lipid. Thank you so much, and wish you all very happy health.
Sure. Thank you so much, sir. It was indeed a wonderful presentation, and we got a lot of insights from today's presentation. Thank you so much, sir. Good day, sir.
Bye-bye. Thank you.
Good day, sir. Thank you so much.
Take care. Bye.